Hey everybody, Dr. Kevin again here, and welcome to day 7 of our beginner spine rehabilitation program, where over the course of 30 days, I hope to show you how to create a full body, comprehensive spine rehabilitation program from complete scratch in what I believe are the safest, simplest, and most effective ways possible. And this is just a compilation of the past 12 years in working with a lot of people who've been struggling with chronic pain and what I believe have been the most effective solutions that we've been able to find for our patients over the years, and to share some of those tips and some of those strategies with you. So day 7, we're going to be starting to cover some new material, and we're going to be focusing over the next couple of days on a concept of known as hip tightness. So I want to just take a couple minutes to explain why we're going over hip tightness, how hip tightness can actually cause lower back pain, and more importantly, what tips, exercises, and strategies that we can use to start to reduce hip tightness, to be able to take some pressure off of your spine to help it feel better, more mobile, and function better over the long haul. So real quick, again, before we jump right into the exercises, I want to go over what I believe is one of the most important concepts of helping you understand why people are struggling with chronic back pain and why a lot of typical treatments that are designed for the spine won't work, and to help you understand how hip tightness is actually one of the most common underlying causes of back pain that most people are just generally unaware of. So the best way to explain this is just to get into a different position. And temporarily you're going to see my head cut off because I really want to help you zero in on the relationship between my hips and how it can affect our spines. So one of the most common problems that we see is a muscle imbalance syndrome known as anterior pelvic tilt. Okay, so again, I just want to take a couple minutes to explain this concept, because this is at the core of what we're going to be going over the next couple of weeks. We'll be explaining it in different ways. We'll be explaining it in more depth, but just to help you understand that a lot of our corrective exercises, a lot of the strategies that we want to employ revolves around understanding this concept of anterior pelvic tilt and how we want to use our stretches, how we want to use our exercise to reverse this problem, to be able to place your spine in a much healthier position. Okay, so at the core of what drives this position and why it is so problematic is just simply the fact that there are a lot of different attachments that our spine has with different parts of our body. And one of the most important connections that it has is the relationship between our spine, our pelvis, and our hips. So with the amount of time people spend sitting nowadays, and with the lack of movement that people get throughout the course of the day, it's very common to see people's hips start to get really tight, really stiff in ways that they may be unaware of, just because it happens so slowly over a very long period of time. So the most common problem that we see is a tightening and a shortening of the muscles in the front of our hip, known as our hip flexors. Okay, and again, this just develops from just way too much sitting. If I just pretend I'm in a seated position here, you can see how there's a lot of tightness, there's a lot of shortening, and a lot of just compression that happens in the muscles in the front of my hip. And again, this can be very problematic for people because it just kind of creeps up on people over a long period of time. But what happens is, as the muscles in the front of my hip start to get tight, as they start to get short, it starts to create a tremendous amount of stress and a tremendous amount of pull in the muscles in the front of my pelvis here, which can start to take my pelvis and start to tip it forward. And again, this is known as an anterior pelvic tilt. And why this is so problematic, if I just show you what actually happens to my spine as I get into this position here. So when I'm in a position where my pelvis is where it should, my back is in a pretty straight, relaxed, non-stressed position. But the second my pelvis starts to tip forward, okay, you can immediately see that my back starts to form this overarched position, also known as a sway back, or in medical term, this is also known as hyperlordosis. But just to tell you right off the bat, just sitting here in this position, this hurts. This feels uncomfortable. I feel compression in my joints. I feel tightness in my muscles, and it's just not a position that I want to hold myself in throughout the course of the day. But what ends up happening is, when people are unaware that this is happening, they don't even realize that they're kind of stuck in this anterior tilted tipped position, the sway back position, And this is at the root of why they're having so much pain, so much spasms, so much tightness, so much stress, and so much inflammation, just based on the fact that their pelvis is pulling their spine into an imbalanced, stressful position. Okay, so again, just to recap, the main problem, or one of the main problems that we see, especially in today's society, is the fact that people are spending way too much time sitting, which creates a tightening and a shortening of the muscles known as our hip flexors. When those muscles start to get tight, it starts to pull on the attachments in the front of our hip and starts to create an anterior tilt or an anterior tipping of the pelvis, which then starts to dramatically increase the amount of compression, hyperextension, and just the amount of stress that develops in the base of my spine. Okay, so again, we're going to be going over this concept many, many times throughout the course of this program, but I want to introduce this concept to you today, so that just gives us a good frame to start to work with, so that we understand how we want to use our exercises to correct some of those imbalances, not as a means of directly doing things on your back, but as a means of fixing a different part of your body that may not be hurting, that could be creating a lot of stress on your spine. So let's get right into the first hip opening exercise for today. Okay, let's get into the first exercise for today. This is a very simple hip flexor stretch, and it's my personal favorite exercise at helping open up the muscles in the front of the hip, while also restoring a lot of the imbalances that develop as a result of having hip flexor tightness with regards to anterior tilted posture, or that sway back posture that we just talked about in the previous segment. And again, this is probably the most effective strategy at just helping restore proper alignment in your hips to help you take a tremendous amount of pressure and stress off of your spine. So let's get right into the exercise. So if you see here, I'm actually kneeling on a soft blue AirX pad. You can just use a pillow, you can use some type of a couch cushion at home, because this exercise might put a little bit of pressure on your kneecap here. So it's just advised that you have a little bit of cushion, just to make sure that you're not putting too much pressure through the knee. So quite simply, I'm just going to start in a kneeling position here. I want to try to keep my knee right underneath my hip, and my front leg is just going to be at just a comfortable angle right in front here. We don't need to pay too much attention. Just make sure your front leg is in a comfortable position. A lot of people might actually feel it's a little bit easier to go through the stretch if you have something to just provide some support. Here you can use a foam roller, you can use a chair, or you can try your best to just kind of power through the stretch without some type of device. But again, if you feel more comfortable using a roller, then I would advise that as well. So a lot of people, when they enter this position, will find themselves in that anterior tilted sway back position. And a lot of my patients are just going to initially struggle. They're going to start to lose their balance. They just don't quite feel comfortable in this position because they're starting to feel some of the imbalances of the muscles in the front of their hip trying to pull them forward. Their back's kind of in a position where it's trying to overarch, and just not having really good awareness of what's going on in terms of the relationship of the muscles of their hip and of their core and of their back. So we want to use this exercise to try to not just stretch this muscle, but to also use it as a means of just restoring and improving some of those patterns, just to help you also take pressure off of your spine as well. So again, the best way to do this is, again, if you just start in a slightly tipped position, I just want you to first look at the angle of my belt line here. And a lot of people will when they start this, will notice that their belt line and their pelvis is in this kind of anterior tipped, forward tilted position. And the first thing you want to do is just to try to make this belt line as horizontal and as level as possible, so that belt line is parallel with the floor and with the ceiling. Okay, how I accomplish that is through a couple of different means. One, I want to try to squeeze and activate this glute muscle through here, and I want to pretend like I have a little zipper in the front of my stomach here, and I just want to try to just zip and just try to pull my pelvis up to just level out that belt line here, while trying to maintain tightness in my glute muscle here. what this is going to do is going to stabilize my pelvis while also start to expose a tremendous amount of tightness that a lot of people may find in the front of their hips here, okay? And as with all of these stretching exercises we've done to this point, once we reach a point where we start to feel some pain, some discomfort, just a lot of tightness in this area, that's where we want to take a nice deep breath, breathe in, exhale, and just move forward into the stretch a little bit here. All right. We want to make sure that we're maintaining the integrity of the alignment of my pelvis through here. And if at any point, if my pelvis starts to dip forward or if my back starts to arch, that means you're not holding the position where you should, and just try to get yourself back into the right alignment, because holding the position, holding the posture, and holding the alignment is the most important part of this exercise. A lot of, again, most common mistake that I see people make when they do this exercise is they're just kind of like leaning into the stretch here without paying any close attention to their back or to their pelvis. So people might see that they're getting a lot of motion through here, but they end up realizing that they're just putting a lot of pressure into the lower back and not getting a lot of stretching in the muscles here at all. But if we're able to just keep everything secure and stable and just tight in through here, really focusing on keeping that level belt line, really focusing on keeping that level pelvis, I guarantee you're going to feel a tremendous amount of stretch and a tremendous amount of pull in the front of the hip here. And from here, again, just take a couple of breaths, breathe in, breathe out, and just push a little into a deeper stretch. If you're really tight through here, you may not get a lot of forward progression or a lot of forward movement at all in the beginning. That's completely fine. Again, just try to get used to the stretch, get used to the feeling of trying to squeeze your glute, trying to keep your pelvis in a nice horizontal position, and just trying to keep your back as flat as possible, and trying to not let your back enter this the sway back or arch position. Okay, so let's do it one more time, and I'll show it from the different angle through here. So same thing, I'll put my right foot out in front this time. And again, a lot of people may find themselves in this anterior tip position. So I just want to kind of zip up, squeeze this glute muscle. And once you squeeze that glute, you should feel a tremendous amount of just tightness and stretching sensation in the front of your hip here. Once you feel that stretch, take a nice deep breath in, exhale, and just push into a slightly deeper stretch. Or again, you may not feel like you have a lot of ability to make forward progression in the beginning. That's completely fine. Just spend some time in this position, just exploring the relationship between muscle in the front of the hip, how it influences the back, and just try to hold everything as tight and as stable as you can. Breathe in, breathe out, and we'll just practice this a couple more times. Breathe in, breathe out, keeping this glute tight, keeping this belt line level, keeping my abs tight, and just trying to keep my back flat. One more time, breathe in, breathe out. Okay, practice 3 to 5 breath cycles on each side. And again, just have patience with this. If you feel like you're losing your balance a lot, if you're just fighting so much tightness in the front of the hip, you can use something like a foam roller or something like a chair just to give you a little bit more assistance, a little bit more support. So you can really focus on, again, just trying to restore the alignment in the relationship between your hip, your core, and your back. Just show it one more time. So to start here, back is arched, pelvis is tipped forward. Just want to zip everything up, tighten up that glute, squeeze my abs a little bit, make sure my back is completely flat and my pelvis is level. Deep breath in, exhale. I'm just moving a little bit forward. We don't need a lot of movement here. We just want to feel some sensation of some type of stretch and some type of opening in the front of my hip here. One more time, breathe in, breathe out. And that's the hip flexor stretch. And let's get into the next couple of hip openers in just a second. Okay, so the second exercise in the hip flexor stretching opening series is just a variation or a modification off of the first in the event that you're just having trouble getting onto one knee, or if you just don't have access to a cushion or a pad, or if you're traveling or if you're driving, just want to find a way to release tightness in your hip without having to get down to the ground. So this is just another modification of the first exercise that you can easily do on your own. So all you need to do, instead of being on my knee, I'm going to start by standing up in this position and just having, in this case, my left leg forward and my right leg back. And again, what we want to pay attention to is just the tilting or the alignment of my pelvis here, which we can see by just the angle of my belt line. And for a lot of people who are struggling with a lot of tightness in the hip flexor, we'll notice that their pelvis is tilting forward, which is going to create this arching sensation in the back, which we want to help you reduce. So same thing here, where I just want to just perform this zipping up maneuver. I'm just trying to pull the front of my pelvis up here, and then just create a little bit of a contraction or tightening of my glute muscle. And once I'm able to get into this position, like so, you should feel a nice pull or a nice stretch right here in the front of the hip. And then from here, you can try to just straighten out your knee a little bit, take a couple of breaths just to ease into the stretch, and then just do a slight little mini bending of the knee just to enhance the stretching that you'll get in the front here. Okay, so let's just start over from the beginning. So I'll start with my left leg forward, my right leg back. And again, if I start to notice my pelvis is tilting forward, my back is arching, I just want to try to just zip up by just pulling up my abdominal muscles through here, trying to squeeze my glute just to try to get my pelvis as level as possible, keeping my glute tight, keeping my abs tight. I should feel a nice pull right here in the front. Take a nice deep breath in, exhale, and just sink down into a stretch just a little further. Don't need to go far into the stretch, just a little bit of movement, and just enough so you start to feel the opening of the muscle here in the front of your hip. And we'll just practice it a couple more times. Breathe in, exhale, and one more time. Breathe in, exhale, like so. And let's just show it one more time from the other side. So right leg forward, left leg back. Notice my back is arching, hip is tilting, or my pelvis is tilting forward. I just want to zip up and pull my pelvis level so it is horizontal in line with the floor and in line with the ceiling. Keep my glute muscle tight, abs tight, back stays flat. All right, should feel a huge pull right here in the front of my hip, in the front of my thigh. Take a nice deep breath in. And just sink down just a little bit into the stretch. You should get a nice pull right here in the front. A couple more breaths. Breathe in. Breathe out. And one more time. Breathe in. Breathe out. Okay, so this is a hip flexor half lunge stretch. Easy to do this one if you aren't able to get onto the ground, or if you don't have padding or cushioning available for your knee. Really good stretch to do right after a long drive, or if you've just found yourself sitting in your office for a period of time. Just easy to do just to try to unlock and release tightness in the hip flexor. So let's get into the last exercise. Okay, so this is the last exercise for day 7. This is a glute bridge exercise. We're going to be revisiting this exercise multiple times throughout the rest of this program, because I think it's just one of the best exercises, most well-rounded exercises, helping us not just open up the hips, but just really helping to counteract and rebalance some of the most common imbalances that we see with regards to hip flexor tightness, glute weakness, back stiffness, core weakness. And again, I also think that it's one of the most underestimated and one of the most misunderstood exercises, in the fact that a lot of people just do this exercise incorrectly, which means that I don't think that they're getting as much value as I think they could be getting out of the exercise, because when done correctly, it's one that's very challenging, very stimulating, and again, just does a lot of work at helping us correct a lot of these problems that we see, especially in today's modern society. So let's get right into it. So we'll start by having you lie on your back and with your knees bent in a comfortable position. And I would say that the most common mistake that people make when doing this exercise is they're just trying to lift their back, they're trying to lift their hips as high as they can towards the ceiling without much concentration, without much focus on their body mechanics or what they should be focusing on within this exercise. So how we generally teach this exercise is by focusing on a couple of very core elements. So one, again, if we want to try to reverse some of the sway back and some of the overarching that people have within their backs, we want to make sure that you try to keep your back flat. So try to keep your spine in complete contact and flush with the ground. And this will do a couple of different things. One is going to prevent your back from just kind of entering this overarched position. And two, is going to teach you how to activate your core to help balance out some of the tightness that you may feel in your back. And secondly, what I want you to focus on is trying to drive your hips up through your glutes. And what this will do is really help expose and help you feel and start to open up a lot of the tightness in the front of the hip flexors here, which is the goal of day 7, which is hip flexor opening. So let's start with the full exercise. So I'll have you start by just making sure that your back isn't lifting off of the ground here, so you shouldn't have any space for your hand to be able to fit through. So you just want to try to flatten your spine and try to compress it into the mat so that to make sure that your spine is making complete contact with the ground. And from here, I want to lift my hips as high as I can while making sure my back isn't arching too much. So really focusing on squeezing my glutes as hard as I can, just keeping a little bit of tension through my abdominals to make sure my back isn't overarching. And what you should feel is quite a bit of pull, quite a bit of tightness in the front here. And you also might feel it's quite hard and difficult just to maintain the contraction of your glutes through here. Okay? Hold it for a couple of seconds. 5, 4, 3, 2, 1, and come back down. So a lot of people initially when they do the exercise with this type of form are a little taken aback by how difficult it actually is. You might start to feel your glutes shaking. You might feel your hamstrings start to cramp up, or you might start to feel this insane amount of tightness or restriction in the front of the thigh. If that's what you feel, that means that's a good thing, because it means you're starting to identify and work through some of those really nasty imbalances that you may not be aware of. But if you do this exercise, if you don't feel much happening through here, if you don't feel a lot of effort happening through your glutes, if you feel a lot of pressure in through your back, that means that you are likely overcompensating by using your back muscles, and those are the problems that we want to try to correct. So again, start by flattening your spine into the mat. Make sure that you have good contact of your spine onto the floor. Dig your heels into the ground a little bit and try to lift up from your glutes while keeping your abdominals tight. And try to squeeze your glutes at the top as tight as you can and hold it there for about 5 seconds. So 5, 4, 3, 2, 1. Come back down. Again, we're looking to feel some tightness in the front here, just and feel like things are getting stretched and open up. You should also feel a lot of just exertion, a lot of just muscles contracting in your glutes or even in your hamstrings a little bit. And you should also feel a little bit of contraction in your core here, but you shouldn't feel any type of pain or any type of tightening sensation in your lower back. If you are, just try to recenter your focus and your attention on your glutes and your abs. Let's just do that one more time. So flattening my spine into the mat, digging my heels up and squeezing my glutes at the top. And I don't just want to just lazily hold myself up here. I really want to try to squeeze this area as hard as I can while also keeping my abdominals tight and just trying to just try to feel and experience all the things that are happening in the front of my hips and also in the back of my hips here. 3, 2, 1, come back down. So that's it for the glute bridge, and that's it for day number 7. Again, this glute bridge is an exercise that we're going to be revisiting many times over the course of this program, but it's one that really helps cement a lot of the imbalances and a lot of the patterns that we're trying to correct with regards to anterior tilt, lower back pain, while also trying to open up the hip flexors in the front. So hope you enjoyed day 7, and look forward to seeing you for day 8. And have a wonderful day, and we'll see you next time.